The new year has certainly brought new challenges. Just when we think it's going away, we have more issues, just like she stated, where so many of our staff are getting infected. So many people are unable to come to work. And I know all of you are feeling that too, whether it's your children getting infected. Most all of us know someone that we know in our family or our friends that got infected over the holiday system. And now that we have all these patients, our record number today actually in our system is very tough. It's highly contagious. Our staff get it very ill with COVID. And then we're really proud of everybody, how they keep going, but we can't have this keep going on because everyone's truly exhausted. And I know everyone has a story to tell. The other thing I'll tell you is please do not come to the emergency department just to get tested for COVID. Those with true life-threatening emergencies need to come to the emergency room with illnesses and injuries. And we actually are seeing patients coming in for other problems that test positive for COVID-19 now. We really would like you to stay at home as possible as you can and use virtual options like we're doing today. Getting personal, last week I operated on 2 patients on Thursday that I'd seen in November to December, and we could schedule them. But on Friday, I had a patient not come to clinic because they were exposed. I had another patient not make it because of snow. And I had a patient that I had to say, well, your surgery needs to be done, but I can't do it in the next couple of weeks. We're hoping we can do it the next few weeks. And hers is elective, but she'd like it done now because she's a professional and can't work. And we're also seeing patients come in with acute issues that we're worried we're not going to be able to take care of you, and it's getting personal. And I actually heard from some family members saying, why can't you take care of my loved one? And I think that's the piece that we don't ever want you to think about, that we have to look at elective surgery the next couple of weeks, and again, temper our enthusiasm so that we have beds and staff and to make it happen. That's happening now in your healthcare access too, where clinics are going to have to close. You may not get that appointment you want, or if you have elective surgery all set up, that it may not happen. So that is the urgency right now, as we're seeing an incredible increased number of patients that need to be in hospital because of COVID, though those are in the hospital with something else with COVID. And as Carl said, so many of them are unvaccinated. So that's where we want to make sure people know you can make a difference if you fall in a category of someone that needs to be boosted, vaccinated, or watch where you go and how you behave in different public scenarios. The best case scenario is we think January is going to be really tough. We don't anticipate much difference because, as you know, when you get infected with COVID, the lagging of coming in hospital, staying in hospital, and get you home is there. So we don't anticipate that. We're hoping that come February, we could sort of see some decreased numbers of people to participate. But so I think the best case scenario is hopefully we can get through January into February with a little better, and we're hoping to be able to turn that around. But if we don't, we may continue for even an extra few months with the same type of scenario. But we're waiting to see whether or not people actually do pay attention and are able to go back to the constraints we need you to do, even though we don't like them, you don't like them, to make it happen.